Assalamualaikum dear doctors. In this video I am discussing how can we take the cerebral palsy CP history. So CP come in exam like CP post meningitis, CP with increased stiffness, CP with precocious puberty, CP equal acute on traumatic, acute on top of chronic or any acute problem. Now how can we take the history? Introduction is similar. First the concern we analysis of the complaints accordingly. What the complaints patient told we will analysis that. We ask when the problem start, OCD onset, when it started, how long the patient is suffering this problem. Is there any triggering factor that increase or decrease this problem? Then other concern associated with, is there any dysmorphic features and any chronic disease present or not. If any chronic disease present, then we take short with this past history. Then what are the questions we ask on that past history? If there is any chronic disease present, when it was diagnosis, where diagnosis, and why, by whom, which team of the doctor diagnosed that, what tests were done for him, treatment given, and regular or not, who gives him medication. So he is taking the treatments and regular follow up or not, we'll ask. Then side effects, follow up physiotherapy team, any trauma past present or not, operations, any surgery past present or not, admission, if previous admission, why and when, and what are the complaint was when he admitted on past. Then perinatal birth history will ask, as usual. Developmental history, especially speech, we will ask. Growth plus red book. Vaccination history will ask. Allergy history act plus minus puberty. If the child age is puberty, then we ask the puberty history. Family plus what are the modifications they taken for this CP child, in whom we will ask. Social and plus support. Psychologically, how the disease impact the family and the patients, how is his school nurse know or not, what are the support he is taking from the school, socially any support taking or not, how financially they are coping, all that we will ask. Schools, type of the school, that we will ask, that any special school he is going or not, and impact, already I told that. Now we go for the systemic review. Systemic review, CNS, we will ask that any abnormal movement presents or not, abnormal behavior, spasticity, if able to walk, what is the gait, if hydrocephalus, that is a size of the head is increased or not. Head size we will ask, increase the intracranial pressure, seizures, then big infarction in brain, vision and hearing, recurrent infections, bugs of the ear we will ask. GIT will ask the constipations, tummy size, pain, problem in swallowing, choking presents or not, we will ask. Salivations, feel FXXX in throat. Then chest will ask recurrent infection, bug infection, recurrent any musical sounds. CVS will ask that exercise intolerance, if the child is moving or not, heart racing even at rest, difficulty in breathing. Musculoskeletal system will ask the back pain and back curving. P will ask the concern recurrent infection of bug, that is UTI we will exclude, incontinency and blood pressure will ask. Now, what are the differential diagnosis of CP patients when come? These are three heading: prenatal, natal and postnatal. Prenatal are genetic mutation FBXO31 RHOB genes. Then TORC infections, fetal alcohol syndrome we know, IUGR, multiple pregnancy, maternal drugs, that is anti-epileptics, maternal hypertension and preeclampsia, exposure to toxins, high level of mercury in seafood or cocaine. Malformations, neuronal migration syndrome, lyssencephaly, then schizencephaly, polymicrogyria, then pachygyria, porencephaly, cyst of the clefts in the brain communicating with the ventricles, radiation exposure. Then natal or perinatal asphyxia, obstructed liver, hypoischemic encephalopathy, birth trauma. So when we ask the CP child birth history, that after birth the baby cry or not, we will exclude the perinatal asphyxia. Then postnatal, any trauma, hypoischemic encephalopathy, CNS infections, kernicterus, inborn errors of metabolism, prolonged hypoglycemia, prolonged seizures, hypo or hypernatremia, sepsis, lead poison, that will be excluded. So this is all about the cerebral palsy or CP child history. Thank you. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.